Welcome back. Everyone. Candace Roberts with us today from Allen County Public Health. She's a reproductive health and wellness coordinator, talking about all the services you guys provide. Well, as we were talking about before we came in, it was just kind of that education component, especially when we talk about early pregnancies, trying to get that message out, right?
Yes.
Yeah. Is that just a matter of going into the schools? What's the best way to do that?
The best way is to actually come to the health department. We do accept anybody 14 and over. To get started on birth control, we have a nurse practitioner who is able to provide those prescriptions. Yeah,
one of the things we talked about too is STIs, and Allen County hasn't had a great history with that in the last few years. We've had some problems there, right?
Yes, our average for gonorrhea and chlamydia themselves is between 70 a month.
What is there? I don't know if there's a way to pinpoint the root cause. I suppose it's just young people being sexually active, that kind of thing. Is there a way to tell what's going on there?
Some people don't like to notify their partners that they have actually tested positive for something. Okay. So those partners continue to spread. If they break up, they get a new sex partner. So there's a lot of education that needs to be done.
I can tell. The syphilis too, you said those numbers are getting a little concerning as well.
Yes. Yeah. Now it's also treatable, but it's on the rise.
Yeah, well, and we were talking too, we think back to when we were in school, and you talked about pregnancy, but obviously you have to hit them with both messages, not just that you could have a child this early in life, but that you could have an STD that might stay with you the rest of your life as well, right?
Yeah, sometimes it even affects the ability to get pregnant in the future if those STIs are not treated correctly. Yeah,
do you think that education, are kids getting that? I mean, it's something, as we say, for 150 years we've been trying to instill in kids that this is a monumental thing, monumental mistake you're making at age 13, 14, 15 years old. Do they think they're getting it better than they did in years past?
I don't know that the health classes at school are hitting on the actual STIs versus the reproductive part.
Right.
So they can come and talk to any of us nurses. We'd be glad to give them demonstrations as far as how to appropriately put on a condom, how to take birth control, the measures that they need to do to be safe.
To be safe out there. The other thing is, okay, so you do have a lot of young mothers that are coming in, and I'm sure it's very scary for them early on at that age. They don't know what to do. And you mentioned, too, that sometimes they don't have a mother figure in their own life to kind of draw from, right?
Yep. So if someone comes in for a pregnancy test, we go through, the medical history, what OBGYN they want to go to. We actually will make the referral for them for an OBGYN, make their first appointment, get everything scheduled, and then we also follow up with the delivery and the 6 weeks postpartum.
You take them from the beginning stages all the way to the end.
Beginning to the end.
Yeah. You seem like a good hub where you guys would be a good coordinator if they need services from another department, or if they have problems or issues down the road that you might be, okay, we can help you get set up with these people.
Yep, so we can help with WIC. There's also car seat, other programs available. We do all the immunizations, so we can see them pretty much till they're 18 and out.
Yeah, probably asking about baby formula now, too, I would think, right?
It's definitely on the shortage.
The other thing you talked about was mammograms. You can provide and get help for that, too, right?
Yep, so we actually have a program, too. It's called BCCP. It's the Breast Cancer and Cervical Project. They will assist with anybody who is uninsured or has a high deductible to cover those insurance costs.
That's the thing to remember, too. You mentioned this, that a lot of people think, well, I don't have insurance, I can't come in and get help, but that you'll work with them on that.
Yeah, we do accept most insurances and even those that don't have any insurance.
Yeah, was there fears, especially during the pandemic, that people were putting off mammograms and going to the doctor and that kind of thing?
Oh yeah, people didn't want to come into the office, with the mask restrictions and the vaccine restrictions, but we are fully operational now.
Ready to go. Candace, there's help available. Thank you so much. We appreciate it.
Good
seeing you. Now go away. More medical news coming up next on Noon Edition.